Do you struggle with an annoying snapping or clunking sensation down in your hip with movements like lifting your leg, running, or going up and down stairs? Well, if so, then this is the video for you, because I'm about to share with you 3 simple strategies to get rid of snapping hip. Let's get into this. So what exactly is snapping hip syndrome? Well, simply put, it's a disorder of the hip where a person feels the sensation of snapping or clunking in their hip joint when they're moving their leg, usually in a forward to backward direction. Now, this may or may not be accompanied by an actual sound of snapping or popping. And although this is very concerning when you feel that sensation or hear that sound, many times these people actually don't report pain. Not all snapping hips are exactly the same. In fact, there are 3 main types of snapping hip syndrome. The first is called internal, and the most commonly implicated structure in this type is the iliopsoas, which is a big, powerful hip flexor that runs here from the lower portion of your torso, through your pelvis, and into the front of your upper thigh. The muscle itself is responsible for this motion called hip flexion. Not surprisingly, the snapping that these people feel is located right there in the front of the upper thigh. Sometimes these people will also complain of a dull pain or an ache in their groin. This is actually the second most common type of snapping hip syndrome. The first most common type is our next type, called external snapping hip syndrome, and the most commonly implicated structures in this type are located along the outside portion of the thigh. Namely, they are the iliotibial band, which is a dense band of connective tissue that runs right here at mid-thigh, and the muscles that tie into that band to give it tension. What happens in this type is excess tension on that band causes it to snap or rub back and forth across this bony lump on the outside portion of the femur called the greater trochanter. The snapping that these people feel is outside, the outside portion of that hip, and it's superficial. You can put your hand right on it when the snapping occurs. The dead giveaway in this type is that when people lie down at night on the affected side, it will hurt. That area becomes very sensitive as a result of that rubbing. And then the third type that I want to mention is called intra-articular, and the name here says it all. This is not super common, but few dead giveaways on this one. Number one, it's usually painful because what's happening here is there's been damage to the structures inside of the joint. So you could have had damage to the cartilage that lines the ball or socket of that hip joint, or very commonly there can be a labral tear. So they can get some pretty severe clunking as they move their leg around. That's intra-articular. But for purposes of this video, we're going to be focusing on the most common type, which is external snapping hip syndrome. Strategy number 1 is a self-myofascial release technique where I'm going to be using a foam roller to force a neurological downregulation of the muscles that attach to that iliotibial band. Now, as a general rule, I'm not a fan of rolling directly on the iliotibial band. Why? Because it's just an inert piece of connective tissue. It does nothing by itself. What animates that tissue and gives it tension and rigidity are the muscles that attach to it. So only masochists roll directly on the iliotibial band. As far as I'm concerned, it's darn near a complete waste of time. To get the most bang for your buck, you should instead focus on the tensor fascia lata here on the outside front of the hip and the gluteal muscles. That's what pulls that iliotibial band to life. And so, when you set your foam roller down, we want to be aiming right here for the TFL. So, face your foam roller, you're going to lie directly across it, and then you're going to need to rotate your hips almost to like a 45-degree angle this way in order to get onto that right TFL. You can see that my left foot is turned way outward, and most of my weight is on my right elbow. And then you can kind of do a quick scan, rolling just a little bit, 5 or 10 degrees in each direction, and find the most tender spot. Then go up and down just a little bit, make sure that you're on it. And then you're looking for like a 4 to 6 inch roll, really short, back and forth. You want to stay focused on that tense spot, and that's going to help activate those stretch receptors and turn down the muscular tone or the amount of tension in that muscle. By decreasing the tension in the muscle, you will decrease the pull on the iliotibial band. It would be like releasing the spring tension on a trampoline, right? You could work the center of the trampoline to pull on all the springs, or you could go to the spring individually. I would argue that going to the spring individually would be way quicker and more effective. Same thing here. After 30 seconds, you're going to lift just slightly and roll onto the back outside portion of that hip and do a quick scan of the glutes the same way. Roll a little bit upward towards the ceiling, a little bit out towards the side, and then top to bottom. Find the most tense area. When you're higher up, you're usually going to be on more glute medius. When you're lower down, you're heading more into that glute max. So find the most tense area for you, and then again, focus there in a short 4 to 6 inch roll for 30 seconds. Once on the front, once on the back, and that's enough to turn down the tone in those muscles. Then we can move on to strategy number 2. One thing that I want to mention about this self-myofascial release technique is that this is absolutely not a no pain, no gain situation. There are lots of different foam rollers available on the market today. There are very firm ones like this, and there are much softer but still very high quality versions like this. You can see when I squeeze on it, it sinks in. So if you've been sedentary or your tissues have been injured for a long period of time, you may benefit greatly from using a softer foam roller. Remember, what matters here is not inflicting pain on yourself. It's the neurological activation of the stretch receptors in that tissue. That's what counts. So use the foam roller that is most comfortable for you, because that means you're more likely to do it. Strategy number 2 is a slow stretch technique where we're looking to lengthen and physically elongate the tissues that cross the back side of the hip and tie into that iliotibial band. Now, these are some of the biggest and most powerful muscles in the body that we're talking about here, so they can be a major player in snapping hip syndrome. What we want to do here is take advantage of the fact that we just turned down the tone in these muscles, and this is the perfect time to stretch them out. So for this example, we're still going after a right snapping hip. So you can see that my left leg is straight out in front of me. I'm going to bend my right knee to 90 degrees. I'm then going to cross my right foot over my left. I want to make sure that the foot stays flat on the floor. From here, you want to make sure that you're sitting up straight and tall, and your head is reaching towards the ceiling. Then you're going to start slowly bringing that knee as close as you can to your chest, walking that foot in as you go. From there, you should feel tension building in the outside and back portion of the right hip. Those are your gluteal muscles coming under tension. Once you've got them under a base level of tension, you're going to take your left arm and you're going to reach around that knee, and you're going to start hugging it into your chest as you push your back straight and your chest up towards the ceiling. That's going to really put those muscles under tension. You can add more tension by reaching around with your right arm and squeezing and hugging that knee into the chest while pushing your back straighter and straighter. I like to think of my arms like a boa constrictor, where I'm just adding a little bit of squeeze or tension, bringing that knee just closer and closer as I hold this stretch for a full 90 seconds. You should just feel that knee just nudging closer and closer to your body. That foot can be free to slide along the floor, but just make sure that it stays flat. You don't want your foot caving like that, because then you're going to lose tension. So after 90 seconds of this stretch, maintaining good posture the whole time, slowly release, and you're ready to move on to strategy number 3. Strategy number 3 involves using light therapy to bring in a fresh supply of nutrients and flush out metabolic waste. Studies have shown that as little as 5 to 10 minutes a day of this type of therapy is enough to radically decrease swelling, inflammation, and pain and discomfort. It's also been shown to rapidly accelerate healing from a host of different musculoskeletal problems, which is why it's number 3 on this list. Now, as far as specific applications for snapping hip go, you just need to make sure that the affected hip is positioned 6 to 12 inches away from your light source. You need to, of course, make sure that the device that you're using is pushing enough power to create that therapeutic effect in a reasonable amount of time, and that it's using the correct spectrum or spectrums of light. Now, I did a whole video just on light therapy where I go into all of that information in detail, and you can see that by clicking the link in the upper left. But if you're still with me and you've got your hip positioned 6 to 12 inches away from your light source, keep in mind that it's best if you can expose your skin directly to the light. So once you've got that in place, you're just going to spend 5 to 10 minutes every single day in that position, and it's going to really accelerate how quickly you recover from snapping hip. And because people always ask, the device that I use is the Red Rush 360. It's from Red Therapy Company. It's an absolute workhorse. I've got them in my clinic and in my home, and I've had them there for years, and I love them. That's all for this episode. Make sure to look out for part 2 of this series, where I'm going to be sharing strategies for dealing with the second most common form of snapping hip syndrome. For more information about the red light therapy devices that I use and to access the discount code that I set up for you guys, check the links in the description down below. I'll also put down there links for high quality foam rollers, both firm and soft. But before you head over to get those, make sure to give the video a thumbs up and subscribe to the channel so that you're updated when that next video drops. That's all for now. See you next time.